Hello, I'm Wendel. I work as a nurse at MedImprove. It's a multidisciplinary practice where we work with pulmonologists and physiotherapists. Patients can not only come for consultation, but also to enroll in a pulmonary rehabilitation program. And last years we've seen many patients with symptoms of long COVID. So a few weeks after the initial COVID-19 infection, they still encounter problems with dyspnea, fatigue, etc. So a pulmonary rehabilitation program might have a very good impact on other pulmonary disease. So we wanted to figure out what was the impact of pulmonary rehabilitation program in patients with symptoms of long COVID, and we would investigate the pulmonary function test and the exercise capacity of those patients. So we enrolled patients with long COVID, and they all followed a rehabilitation program of 3 months. And we did before and after the rehabilitation a pulmonary function test and a cardiopulmonary exercise test. And what we found in the results was that several parameters of the exercise test improved significantly, like VO2 max and the peak load during the exercise test. But at first sight, there was no significant difference in pulmonary function test parameters. However, when we looked good at the data, we found a significant correlation with the total lung capacity at baseline and the difference in total lung capacity before and after rehabilitation. So we can conclude that patients with symptoms of long COVID, that they experienced a significant improvement of the exercise capacity. And beside that, the total lung capacity tended to normalize with a tendency to increase. So we can hypothesize that part of the change in the total lung capacity can be explained by recruitment of partially or completely occluded airways, with resolution of hyperinflation explaining observed decreases in total lung capacity, and opening of fully occluded airways explaining the observed increase. And this research we will do with the functional respiratory imaging of fluida.